Hi, I'm Dr. Kyle Stanley, and I'm the clinical director at Paramount Dental Studio. I'd like to give you some tips about making a digital impression with your intraoral scanner. When intraoral scanners came on the market, us restorative doctors assumed that they would work similarly to how a PVS impression would work, for example. That the scanner would flow into the sulcus and capture everything that we needed to get. However, we now know that that's not the case. So what I'd like to talk about today is the dual chord technique. I use this technique in my practice to take digital impressions. So what we do is we place a very small chord at the base of the sulcus. This is going to be like a 000, 00, for example. This is there to keep down any crevecular fluid or blood. It's not there to retract the tissue. Now, the next chord that we use, this is going to be larger, like a 0, 1, 2 size chord. This chord is there to retract the tissue and separate it from the area around the margin. The biggest problems that we see on the laboratory side are digital scans that don't have the tissue retracted enough. Now, what this causes is it makes it difficult for the laboratory technician to mark the margin correctly. So then when you get the crown back, it may not fit right, you may have an overhang or a submargin, and we have to bring the patient back. So make sure you can use a really nice retraction chord to make sure that the optical scan goes between the tissue and the margin. These will make your scans just flow like butter, and you'll have no problems with your patients.